It's kind of like you go and get your teeth cleaned and then you never floss your teeth. I mean, it's just, it doesn't make sense. If you're going to do it, you got to be all in. So. Okay. All right. So any other questions, hormone related?
Any other pellet? Do you do it in the same place every time?
The same general area, but we rotate from side to side, so we always do the upper buttocks, but low enough that if you wore a bikini, you wouldn't see where the line was. And it's such a tiny, tiny little incision that it doesn't leave much of a mark. Obviously, some of us scar more easily than others, but it really shouldn't leave much of a mark. But we'll rotate right, left each time that you come in. So, and you can't, after you do the pellet for, I'd say 2 to 3 days, don't do any aggressive exercise, but there really isn't a whole lot of other limitations. And obviously I wouldn't sit in a hot tub, but outside of that you're pretty much able to go back to your usual routine. So.
What's the cost of the lab work and all that?
Lab work, if we're just talking about hormone lab work, and just specifically looking at that, if we're doing serum testing, it could depend on your insurance. If your insurance covers it, you may not have to pay anything. If you're paying for it on your own, it could be somewhere in the range of $200 to $250. Salivary testing, if we're doing that, ranges anywhere from $100 to $200. And again, it just depends. When we start out, we need to make sure that we look at all of those hormones and all of your CBC, your chemistries and all that. But after that, once we kind of know where you're at and what we need to follow, we don't have to do a full panel every time. We can just narrow it down to what we're following. But I always recommend once a year that you're still getting a full lab workup, which again includes your red cell counts, your white cell counts, all that kind of stuff, to make sure there's nothing else. It may not even be hormone related. We just got to make sure that everything else is kind of doing what it needs to be doing, because if we run into problems with that, we could give you all kinds of stuff and it may not help you anyhow because you have other underlying issues. So. Okay. All right.